When I read the Guardian article, U.S. surgeons are killing themselves at an alarming rate, I felt like throwing up. I'm sickened so many surgeons are dying. I'm grateful Dr. Cunningham is alive. I felt nauseated that her pain is being used to tout physician health programs as the solution to physician suicide, while these programs have actually led to doctor suicides. Although some doctors with true substance use disorders find PHPs life-saving, others die by suicide in these programs. Yet I can't find any major media articles on these dead physicians. I know 23 doctors who died in these so-called health programs. None can speak out. None can respond to this article. So, on their behalf, I must. 1 week before the Guardian article debuted, I detailed how PHP abuses have led to doctor suicides in a letter to the Department of Justice. Here's what I wrote on September 17th. Today is National Physician Suicide Awareness Day, and I wish to make you aware of doctor suicides resulting from Title II ADA violations by medical licensing boards and their exclusively authorized and contracted physician health program. Violations are many: impermissible inquiry, discriminatory medical exams, excessive testing, lack of individualized case analysis, refusal of accommodations, to name a few. But I'm not writing to call your attention to a list of violations. I'm writing to speak for those who no longer can. 23 compassionate, competent, dedicated doctors whose deaths were directly related to willful violations of law by PHPs, both empowered and immunity protected by their state medical boards. In 2012, after 3 doctor suicides in my town, I urged local reporters to cover these tragedies. They refused. Outraged, I felt compelled to investigate this alarming phenomenon on my own. Since then, I've run a free physician suicide helpline. I've heard from countless U.S. physicians who became suicidal under the care of a PHP. Mistreatment so unfathomable, I was in disbelief, until others reported the same tactics employed by their state PHPs. A few common themes. Physicians forced into PHP eval following anonymous, unsubstantiated tips, often retaliatory, with no avenue to explore or appeal allegations of disability or impairment. PHPs endorsing unfounded diagnoses of substance misuse via non-FDA approved, non-SAMHSA condoned drug tests known for false positive results. Physicians with no history of drug or alcohol use automatically enrolled in costly out-of-state inpatient faith-based abstinence programs, followed by 5 years of drug monitoring and AA attendance. Non-physician bureaucrats recklessly endangering doctors' lives by overriding their established psychiatrist treatment plan with PHP one-size-fits-all protocols. To keep their medical license, doctors must quote-unquote voluntarily agree to travel out of state to PHP-preferred facilities where they may be interrogated via polygraph during a 4-day multidisciplinary evaluation for up to $10,000 cash, no insurance accepted. Physicians who cannot afford to pay thousands of dollars to these for-profit PHP-preferred rehabs get reported to their board as non-compliant, usually resulting in license revocation with automatic entry into the National Practitioner Data Bank, rendering the physician unemployable. Medical boards then publicly disclose physicians' disability-related license revocation, HIPAA-protected health information detailing unsupported yet unchallengeable misdiagnoses, all published on the World Wide Web in perpetuity. I've twice implored Oregon Medical Board to track doctor suicides in our state. They refused. While touting their success in self-funded, unverifiable studies, state PHPs also lack transparency, failing to investigate their own physician suicides. Legitimate accredited health facilities are required to report suicides as sentinel events to Joint Commission, perform internal case analysis, and correct deficiencies. The MedBoard PHP complex behaves as if it's above the law, refusing to disclose suicide incidents, declaring study participants lost to follow-up, while concealing rights deprivations contributing to their deaths. Distraught by Oregon Board's refusal to collect doctor suicide data while my peers were dying and board-ordered PHPs known for mishandling physician mental health and impairment allegations, I began tracking these doctor suicides. I've now cataloged 23 PHP suicides by name, date, specialty, location, method of death, and circumstances. For in-depth documentation, including video interviews with PHP victims and their family members in the aftermath of these doctor suicides, please contact me. I thank Christina Frangel for her compelling article on Dr. Cunningham, a stellar surgeon, never a danger to patients. No wonder she wanted to throw up when the PHP declared her unfit to practice medicine and mandated years of random testing for drugs she'd never done in her life. PHPs claim to counter the myth that illness automatically means impairment, while concurrently labeling competent physicians as impaired. Forcing physicians to abandon thousands of patients endangers the lives of doctors and their patients, who have also died by suicide when their doctors were ensnared in PHPs. As an award-winning journalist specializing in health, medicine, and social issues, you'll likely be disturbed by the dark side of the forced physician rehab industry that makes millions off the suffering of our vulnerable doctors. I respectfully request a follow-up piece about doctors who have died in physician health programs. Their voices deserve to be heard.